How do doctors define remission in rheumatoid arthritis? When we talk about remission in rheumatoid arthritis, it's important to understand what that really means. Doctors define remission as a state where there is minimal or no detectable inflammation and disease activity. This indicates that the disease is effectively controlled. In simpler terms, remission means that symptoms like joint swelling, tenderness, and pain are absent or nearly absent. It also involves normalizing blood markers that indicate inflammation. To assess remission, doctors use standardized clinical criteria. This includes checking 4 clinical measures of joint inflammation, meaning there should be no swollen joints and very few or no tender joints. They also consider patient-reported outcomes, which reflected how patients feel about their disease activity. A low or absent patient global assessment is crucial here. Laboratory markers play a significant role too. Doctors look for normal or near-normal levels of inflammatory markers like C-reactive protein and erythrocyte sedimentation rate. Additionally, composite scores are used, such as the Disease Activity Score in 28 Joints, Simplified Disease Activity Index, or Clinical Disease Activity Index. Remission is often defined by specific thresholds in these scores that indicate very low disease activity. The American College of Rheumatology and the European League Against Rheumatism have developed clear remission criteria. These include a tender joint count of 1 or less, a swollen joint count of 1 or less, and a C-reactive protein level of 1 mg per deciliter or normal. The patient global assessment should also be 1 or less on a scale from 0 to 10. Alternatively, remission can be defined by a clinical disease activity index of 2.8 or less, or a simplified disease activity index of 3.3 or less. It's crucial to note that remission does not mean the disease is cured. It means that inflammation is controlled to a level where joint damage progression and symptoms are minimized. Achieving remission is often the primary goal of rheumatoid arthritis treatment, as it leads to better long-term outcomes and improved quality of life. In practice, doctors relying on these criteria to guide treatment decisions. They aim to reach and maintain remission, or at least low disease activity through medications like disease-modifying antirheumatic drugs, biologics, and sometimes low-dose corticosteroids. However, remission definitions are clinical tools and may not capture all aspects of disease activity. For example, some inflammation may still be present but not visible through standard tests. Therefore, ongoing monitoring and personalized medical advice are essential. In the context of rheumatoid arthritis, remission is a critical therapeutic milestone. It helps reduce joint damage and disability, enhancing patient function and well-being. Since rheumatoid arthritis is a chronic autoimmune disease, remission requires continuous management and does not imply a permanent cure. In summary, doctors define remission in rheumatoid arthritis as a state of minimal or no clinical and laboratory evidence of active inflammation, assessed by validated criteria that include joint counts, patient assessments, and inflammatory markers. The ultimate goal is to prevent joint damage and improve patient outcomes.